we need to give these services so that we don't create another outbreak in an outbreak. For example, if you stop the immunization, then we shall have issues. If you don't treat the chronically ill, we shall have issues. So it's important to continue offering these essential health services. But while you offer it, please remember infection prevention and control, because we all need our lives. We need to protect ourselves first, and that's the principles of infection prevention. And also, we have to protect the patients. You must have been told, or you are aware, that we are up to 9 cases. The 9 cases of Ebola are within us. And the funny bit is that they're only looking at the private facilities. These people come to seek care from the private facilities. And you never know, tomorrow it could be a public facility. So that's why we are holding these webinars, to give you information, to tell you that, excuse me, there's a problem here. What should we do? We need to continue offering these health services, but also there is Ebola out there, and we need to have IPC. It really hurts to go to a facility and you hold service delivery. We have so far held service delivery to 3 facilities. That is not right, because we want to continue offering essential health services. At the same time, you cannot offer the essential health services if you don't have IPC. These facilities will find them not practicing, when they've not put the measures for infection prevention and control, which is not good. So there's been an outbreak declaration in the country. Can we have everyone protect themselves, especially if you're in health service delivery? Because you never know when you are going to get exposed. And Maureen has ably told us the mode of transmission. She has explained the phases or the stages, the different symptoms. And what she's asking for is for us to have a high index of suspicion. How do we start with raising that? Is there any epilink, history of travel? Are these signs and symptoms similar? Then you rule out. But as you are doing all that, please protect yourself, because your life is fast. Only a pair of gloves can save you. Please move with sanitizer. Break that transmission chain so that we can have you alive to continue giving this service. There are screening tools. Can we use that screening tools? Have you put in place a triage? Have you put in place an isolation point? And she has gone ahead to explain that the need to have the cleaners also be conscious and practice that prevention. Let's put disinfectants. Go as far as the management of the waste. Can we have the waste sorted, the highly infectious not mixed with the domestic? And then the people handling, shouldn't they have PPE? Let them have PPE, because every life counts. So thank you so much. And before that, we had listened to an experience of a survivor. He ably told us what he went through and how he got exposed. So can we please look at all that and put them in place? Please don't hold on these suspects. In the last webinar, we were told we want to become heroes. We want to treat every case. These suspects are supposed to be referred. So thank you so much, Maureen, and our first speaker. Now, next, we are going to listen to Dr. Dennis Buluma. Dr. Dennis Buluma is a supervisor, Lubaga Division, or Division Medical Officer, and he's in charge of surveillance. So, she's in charge of IPC. The two are inseparable anyway. So, Dr. Dennis, please take the floor. Tell us what we should do, and tell us what you've prepared for us. Over to you.
Thank you very much, Chair and Director. Good afternoon, good evening, colleagues, and thanks to Dr. Maureen, who has shared the key standard protocols of IPC. Colleagues, What I'm looking at is IPC investments and opportunities for us private healthcare providers. As the director has rightly put it, this current infection is mainly or largely so far ravaging the private health sector. And it's an imported infection like the others have. From Congo, we have 9 confirmed cases, and the level of risk is still high because we receive many Congolese colleagues for business. Some have families here, and some come for medical tourism treatment, and that's how we have gotten in this situation. So what I'm looking at is why must you as a private healthcare provider think of investing in IPC? And what are the opportunities for those in logistics and other healthcare areas? This is not the first Ebola outbreak Uganda has had. This actually is the 9th recorded outbreak. Uganda has had built capacity over the years in managing Ebola. That does not make us immune to getting outbreaks, but also we know that our healthcare system is an ecosystem. It produces, workers and recycles them in and out. So capacities need to be continuously built over time. It's not a one-off event. And that's why at every outbreak, we check our preparedness and how we are standing. And we're talking about infection prevention and control because during outbreaks, infection prevention and control gaps usually get very fast exposed because, as we have been told, this is a contagious infection. And therefore, if we have any lapses in our IPC protocols, then the infection will move very fast to spread. And healthcare workers are not usually spared. In the last outbreak we had in 2022, I think we had over 19 health workers confirmed infected, and we lost 7. This is not a situation we want to have this time round. Of course, the very first outbreak of 2000 had the largest case fatality on our healthcare workers, and those are issues we want to prevent. So where are we now? What are the key IPC investments and the needs that we are looking at? Currently, what our healthcare system lacks and is also trying to fix in IPC is around screening, isolation, and notification, which are very key, like Dr. Maureen highlighted. In 2018 assessment, IPC assessment of frontline healthcare facilities in high-risk districts in Uganda, it was found that there were key gaps in 3 key IPC areas. One was on the PPE and the viral hemorrhagic fever kits. And the MOH and partners delivered some of these kits and PPE and waste management and cleaning supplies to protect healthcare workers. The other big gap was on training on donning and doffing of the PPE. In the 2022 outbreak, donning and doffing was at only 78% of healthcare workers could correctly don PPE, and 68 couldn't doff it off safely. And this, of course, helped in shaping the new training curriculum that is now being used. But there was also a gap on waste management, safe barriers, and decontamination. Of course, these were part of the hemorrhagic fever kit. There were other gaps in maternity, IPC in maternity centers because of the level of, how weight our maternities by default are. And if there is an infection or a suspect, a case there, the infection can very easily spread if our peace protocols are not up to standard. There exist opportunities for private healthcare providers in Uganda in IPC. And these opportunities are in contracting and supply opportunities for logistics. For example, right now in this outbreak or whenever we are in outbreaks, logistics like PPE, the kits, donning and doffing kits, the IPC supplies, the jig, chlorine, and all the like, the soap, usually are required in large supplies. Donors and the Ministry of Health usually buy this in bulk, but also some of the distributors do last mile distribution to private facilities that creates opportunities for local suppliers. And therefore, private pharmacies and clinics can also benefit as authorized distributors of the key suppliers. There's also opportunity in medical waste management. Ebola response requires safe disposal of medical wastes. Private waste companies that are involved in this, that meet the standards, are usually encouraged and encouraged to get involved in management of medical wastes of this nature. Of course, we have also opportunities in decontamination services, usually in areas where there is suspected or confirmed cases. There will be need for disinfection, and people involved in this or companies that have a niche in this area come in handy away from what we do centrally during the Ring IPC. We have opportunities in the training and service delivery, IPC training specifically. The ministry and partners usually run training for health workers to orient them during outbreaks of this nature. But private training providers or institutions, schools or hospitals can actually partner and provide approved MOH training modules, for example, on PPE use, on screening and isolation, and other measures that have been approved. There are also opportunities in screening and isolation units, facilities that set up Ebola triage and isolation centers that meet specifications. In the previous outbreaks, when resources allowed, would receive supplies and technical support. And so we encouraged, like we've been told as part of the IPC protocols, to set up screening areas for clients, but also isolation points in case you get a suspected case as you await evacuation. That way you limit exposure to the other clients if your space can afford. Laboratory and diagnostics, again, private labs that meet biosafety level measures can be integrated in the surveillance network. Right now, there's a lot of surveillance needed to ensure we're able to catch and break this, the transmission chain. There are also opportunities in readiness. There was an assessment done in the other outbreak in Ginger that showed, for example, that only 55% of the facilities had high EVD readiness, especially in logistics and supply chain and laboratory systems. It is noted that donors often channel readiness grants through public-private partnerships, and the private clinics in high-risk or border districts that are eligible for this readiness support usually will benefit if they are registered with their district health teams and they are known. In other areas, here I think we've not done, because usually our cases are treated in Ebola treatment units. But in West Africa and other areas, there has been a practice of doing reimbursement for private providers who manage suspected cases. Of course, our resources may not allow, but there was an experience on that in 2024, 2026 West Africa outbreak, where facilities that met the standards and were allowed to manage suspected cases would get reimbursed for their service. What can provide private providers invest in now? Where are investment areas? Right now, investment areas are in IPC infrastructure. We are looking at things like hand hygiene stations. We are encouraging hand washing as one way of preventing transmission. So the hand washing stations are needed. PPE is needed, but also designated isolation rooms and safety waste bins for medical wastes. The other area is staff training, especially on doffing and donning, drills, triage protocols. Usually ministry provides this together with us for the providers that have high risk, but also we are trying to get out to as many providers as possible to have these drills. We are setting up, and soon we'll activate our IPC teams in the divisions that can provide support on this. It is important that the facilities are also complying with the legal regime. Have your licenses updated, and so that it is easier to get to you, and it's easier to work with you in this process. The opportunity for this usually is not in treating Ebola cases, because like we've said, Ebola cases are usually managed in well-established Ebola treatment units because of the nature of the level of expertise needed. So we do not encourage private providers to treat confirmed Ebola cases. Ours is to set up isolation units, screen, and if we're able to identify those that meet the Ebola case definition, then isolate those, and then get notify so that sample can be taken off and the patient can be managed well. If confirmed, they will be evacuated to the established treatment unit. However, like we've said, the opportunities there in IPC logistics, especially, and the supply chain around IPC logistics. It is important for us as private providers to note that in an outbreak of this nature, we need all our healthcare workers alive. Because if they are infected, it has a serious negative impact on your business. But also we are looking at your company name, the business name of your facility. You do not want to be a center that will be known for confirmed cases. Not that you should hide the cases, but that if you have lapses in your IPC, that is going to lead to the facility becoming a source of infection to your clients, then your business will be negatively affected. But also, more importantly, you will invite government to actually close you down, because we do not want to have a situation where we get into a loss of health workers and other community members because of laxity. So there is every reason to invest, if you're a business owner in healthcare services, to invest in IPC protocol, in IPC right now, especially to ensure that your healthcare facility stays afloat, your healthcare workers stay well and healthy, but then you are also able to assist the community so that essential health services can continue to be received at your center without interruption. Again, we do not want to go to the situation of COVID-19 where we had many of our service utilizations drop because of the lockdowns and the restrictions we had in movement for many of our healthcare facilities. People were not able to access. That is a situation we want to avoid by ensuring that we maintain the standard operating procedures and invest in the requirements, the things, the supplies needed to ensure that our healthcare workers are able to keep the standard operating procedures alive at all times. Director, that's what I wanted to share. I thank you.
Thank you so much, Dr. Buluma, for that presentation about IPC. And you mentioned the importance of IPC and why we should also continue to offer services. Thank you so much for that. And can we have now the questions? I don't know who is at the back end, who was our moderator today, to share the questions that have been coming through, or if you can just raise your hand and we hear your concern or question, please. We still have the 3 speakers on the call. We had the first one who gave us the experience of Ebola, and he managed to go through the isolation and treatment, the signs and symptoms, and generally his experience. Then we had Dr. Maureen, who took us through the continued essential health services, the importance of it, and also that you cannot continue to offer essential services if you don't have IPC. Then she also told us about the screening tools. She ably told us what is required. Yeah, thank you so much. I can see the questions. The questions are clear here. The first one is, some askaris are putting on gloves at the gate while screening, and they are worn the whole day without changing at any point. The same gloved hands are touching everywhere and everything, including their own phones, from pockets and back. Presenter, you may need to highlight better guidance regarding that. I witnessed it in 2 health facilities. Okay, thank you for that. It's very important. As carries, we also see health workers at triage points wearing gloves that they're not changing. Then we've experienced it even for our contact tracers. So, Maureen, can you please answer this question? Maureen, please unmute. Maureen or Dr. Buluma, take up that question, please.
Thank you, Chair. Probably Maureen is having trouble. But the issue of gloves is a serious one. Maureen hit on it. Gloves are a single-use IPC PPE, really, colleagues. If you are using gloves, then make sure that you're going to change them after every client. And for people like us carries at the gate, the issue of wearing gloves and then they stay with the same gloves the whole time, and they are neither sanitizing them, because then the gloves denies them the opportunity to physically wash the hand. It becomes actually a source of transmission. So they would rather not put the glove, the askaris, but frequently wash their hands or have a sanitizer that they frequently sanitize at various points during the day. Otherwise, they're actually causing transmission along the process. That's my submission. Director?
Thank you, Dennis, for answering that. Yes, it's a single-use PPE, so it has to be changed. So whoever is using askaris that are putting on gloves for the whole day, that should stop. And I think we've taken it up. Please, Dr. Dennis, take it up and inform the teams to be vigilant. If they observe such a thing, it should be corrected. That's a huge gap. The second question is, the person I think needed guidance on the numbers and Gmail. I think he wants to register. So can you give the Gmail and the person registers and also the numbers? He wants to know the number, I think, the number to report suspects, probably. The number to report suspects, I'm going to share with you, or Maureen. Maureen, can you share the number, the toll-free lines for both KCCA and Ministry of Health, and also the Gmail? The person who is coordinating, please go to the chat and write the email. This Gmail, I've not understood your question very well, but we want your email address so that we can share the slides. Okay. The numbers, I just know offhand the number for KCCA. It is 0800 199 000. And for Ministry of Health, the number is 0, trying to find it. For Ministry of Health, we have 0800 0800 100 066. Hello? Have you gotten the numbers?
Kindly repeat.
For KCCA, I'm trying to get the poster so that I can share it. Please hold on so that I share the poster, or I hold on a bit. The number for KCCA is 0800 199 000. Then there is the number for Ministry of Health. It is 0800 100 066. But I'm going to share it shortly on the screen if the moderator can allow. Can I please share on the screen?
It has actually been written in the chat.
Perfect. Ministry of Health is 0800 100 066. Then KCCA is 0800 199 000. Then we have 6. There's another where you can send an SMS and you type alert. You can send an SMS to 6767 and you type the alert. It will still get there. Then there's also a QR code that I'm going to share. I'm going to share this poster that shows how to report an Ebola suspected case to health authorities. Right now, I've shared on your platform for UHF so that you don't get any excuse, please. Or let me share with Ivan to disseminate it. Okay. and the rest are from Congo. Then you have 3 health workers that involved in service delivery, 2 physicians and 1 of the other cadre. How best is the ministry intending to work with partners in health to sensitize the community on EVD? How best is the ministry intending to work with partners in health to sensitize the community? Right now, the ministry is working with partners, the invited partners, and also KCCA is working with partners to do exactly that. You can see we are working with our partners, UHF, to ensure that you get this information. And there are many more partners. So if there are partners out there, please come in. The door is wide open. Ministry is waiting for you. KCCA is waiting for you so that you lay a hand. And also where you are, please sensitize the community, your community of patients, sensitized wherever you can get an opportunity so that we kick this Ebola out of Uganda. Yes, can you share with us the screening tool? Maureen, do you have the screening tool with you so that you shared it? We can share that screening tool even on your emails. Whoever wants materials that of what we have shared, the posters, any IEC material, any short videos, please share the email. You share your email so that we can register and share your email. Maureen has said she can share it, so please do the needful so that you get this important knowledge. Yes. The other side of IPC rests on compliance, where the health workers need to adapt to practice hand hygiene as in the 5 moments. True. Where the health workers need to adapt to practices of hand hygiene as in the 5 moments. It's important to also observe the 5 moments so that you have your hands actually very clean. Next, we have another question here. Can Ebola virus affect neonates or children? Maureen, over to you. Can it affect neonates?
Yes, no one is spared. So it affects, yes, the neonates as well as the children. And there is guidance on how to support the neonates in terms of care, based on whether the mother is also considered, has already been checked and confirmed EVD. So there is guidance for a neonate or child that has been affected and what they need to continue to do. And where we have a breastfeeding mother whose neonate is negative, the guidance is also available on what they need to do. So it can't affect everyone. No one is spared in a virus.
And Maureen, please answer question 8. Does KCCA has a quarantine center ready to receive identified contact?
Yes, we have quarantine centers within the Kampala metropolitan area, and once these suspects have been notified, the team is able to pick them up and will be able to be supported. All the contacts that have been identified in quarantine centers designated, and they have clinicians that are following up these patients.
Good. So the next question, Dennis, answer it, please. How is the temperature gun used? And remember, as Chris is not help to point it on the head. How is the temperature gun used? It is not healthy to point it on the head. I can answer that. There are various temperature guns. some guns are for the ear, where you measure the temperature, and these are the just orifice of the ear. Then there are those that can be put at the thorax. So they are, when you read the instructions, even you can put it on the scale. So it depends on the temperature with the specifications and how you can measure it as instructions on how to use it. During this outbreak period, was there the incubation centers for Ebola? Thank you very much for that question. It is very important at this point in time. There is also, if there are also efforts geared towards schools. I think we've seen the steps for the schools. It is working well.
Yes. Thank you very much, our beloved presenters, for this wonderful talk that you've delivered it to us. We've really had quite a lot of things to learn from this talk, and I must tell you that yes, we are now much more well equipped with whatever it takes to fight Ebola. In a special way, I really want to thank the people that have taken us through this presentation, and I'll be very specific and I'll mention the names. To start with, I want to start by thanking Dr. Sarah Zarango, the Acting Director of Public Health and Environment for the Kampala Capital City Authority. Thank you very much for taking us through this topic about Ebola and showing us how it interacts with the environment. I also want to thank Dr. Herbert Muhindo, who is a pharmacist as well as a survivor of this Wundibujo Ebola virus disease. Realize that Ebola is a quite serious disease, and it's not one that somebody can survive very easily. But Dr. Herbert here is a pharmacist, a health worker for that fact, and had Ebola, survived it, and right now is a survivor. I also want to thank Dr. Baluma Dennis, who is also a supervisor of the medical services in KCC, and is also an IPC coordinator. Those of you who don't know what IPC means, IPC actually means infection prevention and control. And for us to be able to control or contain this Ebola virus, we really need to ensure very good IPC. Okay, so for that reason, I hope you've had something to learn from this session. Lastly, I want to thank Maureen, Dr. Maureen Twaire, who is a senior medical officer and is also technical lead for the Ministry of Health. So the conversation has really been a very rich conversation. We've had quite a lot to learn. And those of you who are just joining us, I'm going to try and take you through some of the key issues that have been covered in today's conversation. As you all know, this conversation was beyond the scrubs. Right now I'm in a scrub, but we're asking ourselves what really goes beyond the scrubs, especially given the current Ebola pandemic that we are suffering with. So we've looked at the doctors and private health workers, because usually most of these interventions that we see tend to focus mostly on the government facilities, and the private facilities have sometimes been neglected. So in this session, we've seen how best the people in the private sector can be of importance in this fight against Ebola virus disease. Now, we've seen that there are quite a number of updates regarding this Bundibujo virus outbreak. We all know that we've had some cases, and as we speak now, from the latest updates, the cases are 9 cases that have been reported, and we've already had some deaths in this country, which is very, very unfortunate. So, so we've learned from this session today that early identification of cases is very important. People in private facilities out there, you must understand that you can actually be the very first contact of this Ebola patient. This Ebola patient can walk into your facility with these high fevers, they are having nausea, they are vomited, they are sweating. Sometimes they could as well come with bleeding, which could be from any part of the body. It can be from any orifices. That includes the mouth, the nose, the ears, the genital parts, or even any other body parts. So a patient could actually come to you, and you're the first person that they are reaching out to. So as a healthcare worker, you're required to know the signs and symptoms which these patients are going to present with, and if you should have a very high index of suspicion, in that if a patient probably or has some of these features that are suggestive of Ebola, you need to do the needful, and that is identifying this case quite early. So private health facilities and practitioners are often the first points of contact of these patients. We've all seen that this index case of Ebola that we had in this country, we all heard about a facility where it was detected. And this first facility where it was detected was actually a case which was actually a private healthcare, private healthcare setting. So people in private care, be sure that you can actually be the very first contacts for these patients. And we realize that many patients in Uganda initially seek care from private clinics, okay, pharmacies and hospitals before they reach up to us in these settings where we are in the public facilities. So at any time a patient can come to and actually the Ebola cases. So you need to have a very high index of suspicion, and consider Ebola patients those who present with fever. Okay, most of the patients that come with fever, you should think about one of the diagnoses that you should think about is Ebola. They could come in with unexplained bleeding, they're vomiting blood, they're coughing blood, they're having blood discharge through maybe from the mouth or the eyes. Okay, they could have gastrointestinal systems. This could include things like vomiting, they could be having diarrhea, and sometimes most of these would actually have Ebola, or could actually have blood in them. Sometimes they can come with weakness or headache. Sometimes some of these symptoms are compatible with the exposure history. So it's always important that we screen these patients, and the screening should be consistent. If a patient comes in, we need to screen them. Let's take at least their body temperature. Let's find out if they have some of these symptoms. All the screening points in most of these health facilities should have screening equipment. Let us have at least a thermometer that you're going to put on this patient and see what their temperature is. I've seen people these days are using temperature guns, which do not require a healthcare worker to be in direct touch with the patient. So we always need to get the temperatures of our patients as they come to us. And we need to screen patients before they mix with the general public or before they get in touch with our health workers wherever we are. The moment we have some suspected cases, it's quite important that we isolate them. Okay, put them in a place whereby you're going to limit their contact with the general public, because if you don't do this, these patients can actually get in touch with many other people and they end up spreading this virus. So it's always important that you identify, isolate and notify. By notifying, meaning engage the relevant ministries, engage the relevant people so that they do the needful. And any suspected cases should be isolated immediately. We should not allow prolonged waiting, unnecessary movements or exposure to other patients and staff, because the moment we do this, we're probably putting other people at danger. Apart from that, we need to establish designated isolation facilities. Okay, some of these could be temporary. I've seen in some of the facilities people have put up some tents where individuals can actually be isolated. So we need to start putting up designated isolation points where our patients can be kept as we're trying to process the other steps in their management. And even small facilities should have at least some basic isolation facilities. Should we get a case of suspected Ebola, these patients can be directed to some of these points. They can be taken care of as we notify the relevant people, including the Ministry of Health, to come and take the necessary precautions. That said, there's also a need to mandatory notification of the ministry by the health teams. Realize that currently where we are, most of these facilities do not have the capacity to manage these Ebola cases on their own. At least we need that extra hand from the Ministry of Health, because they have trained experts that can help in the management of these cases. So, should a patient come in with these symptoms and you've suspected them, you've isolated them, you put them in a temporary place where they can be, it's always important to at least notify the ministry, notify the people. The numbers all over the place, okay? If you don't have the numbers, these numbers have been mentioned earlier on. Call and notify the relevant authorities who are going to come, and they do the needful in terms of infection prevention and control. These teams are well dressed. They have all the gears, the protective gears, the aprons, the masks that they are going to use to control or help in the management of the case. So let's always try to notify, and so that the teams can come and support. So the suspected cases should be promptly reported to the responsible health teams, including currently the Ministry of Health response team that should be able to come in appropriately and immediately to help in the management of these cases. Do not attempt to manage these cases by yourselves because you don't have the capacity in your private facility. Much as yes, you have the doctors, you have the nurses, but you've seen that to manage Ebola is a lot that is required. So do not attempt to manage these cases by yourselves. Timely notification is also important. It's always important that you inform the teams on time. Okay? Inform the teams on time so that they have enough ample time to come and intervene where possible. So when you notify us early, there's also at least going to be rapid investigation, and the facilities are going to be empowered to be able to notify. Like I mentioned earlier on, the numbers are right there if you, in case you need them. But then it's always important that you call on these numbers quite ahead of time so that we get to know, and the necessary precautions can be taken. So it's always important that facilities do safe transfer and expert management. So not everybody should be able to manage these Ebola cases. Some most technical skills are required. So it's important that you notify so that experts can come in and support. And also, this helps in preventing the amplification of these cases not to escalate. Infection prevention and control is a non-negotiable priority when it comes to management of Ebola cases, because without proper IPC, without proper infection prevention and control, this disease can be spread very fast and can escalate. So effective IPC is the thing here in the management of Ebola. IPC investment is not optional, it's essential, and this message comes to most of the people that are practicing in the private facilities. It's quite important that we invest at least the basic things. IPC materials. Do we have enough gloves? Do we have the thermometer guns? Do we have alcohol sanitizers? Do we have staff that can help us screen patients as they come into our facilities? So, investing in IPC is not negotiable. It's an essential thing that we must all do in our different facilities. Hand hygiene systems should be in places, okay? They should be in place at any of the facilities. PPE availability and proper use, okay? Mere having PPE there is not good enough. You also need to train your staff so that they can they know how to utilize IPC adequately and very well. Environmental cleaning and disinfection is very, very key when it comes to management of Ebola, as well as waste management. You notice that many times, many people are not actually well versed with the management of Ebola, okay, and management of waste. And yet, we know that with this Ebola, actually the disease can actually be spread through the waste. So it's very important that we ensure that our waste management is also on point. Do you know what to do with the red bin? Do you know what goes in the yellow bin? Do you know what goes in the black bin? So all these bins must be well taken care of. Our waste has to be well taken care of. And apart from the waste management, we also need to do safe patient flow. Let's have clear ways, clear structures on how patients are going to move from the time they come into our facilities up to the time when we discharge them. Proper use of gloves and PPE is very, very important, and wherever I find incorrect use of PPE or gloves, we need to whistle blow, and where possible we guide and advise. We've had situations where an askari is going to be on the gate, and you know they are the ones doing the IPC, they are the ones who are taking people's temperatures, and you know this askari uses the same gloves from morning to evening. That could actually be a possible source of infection, this can actually be a point of spread of infection. So there always needs to be proper use of gloves and PPE, and they have to be used appropriately. Apart from that, there have been concerns really that security personnel like askaris are screening patients while using the same gloves throughout the entire day. We've also heard that there are some health workers who are at the triage points, and these ones are wearing gloves continuously without changing them in between. Definitely, this is not a good thing. So this practice can actually result into spread of infection from one person to another. So key IPC advice I have for you is you need to always change gloves appropriately. Okay, if a glove has been used and it has done its role, let it be removed and you put others, and you wash our hands and we use alcohol-based sanitizers wherever possible. Okay, we always need to do proper hand hygiene. When it comes to Ebola, hand hygiene is a non-negotiable. We always have to do proper hand hygiene, avoid unnecessary glove use, and also use PPE according to the exposure risk. If the exposure is not very much, probably we may also be a little bit loose regarding some of the PPEs. However, wherever there is very significant exposure, we have to ensure that we use the appropriate PE depending on the exposure risk. Talking about triaging and screening patients, basically there are a number of screening tools that can be used, but then these should be simple, practical, and consistently used. The triage teams should always screen for the symptoms of Ebola. And which one are those symptoms? Fever. Okay, patients coming to a health facility, how are their temperatures? Ebola patients are likely to have temperatures that are quite high. Fever aside, are the symptoms that are compatible with Ebola. We've already talked about things like bleeding from all body orifices, okay, some gastrointestinal systems, including vomiting, diarrhea, nausea, okay. But those aside, we also need to ensure that there is clear patient flow, as well as separation of cases, suspected cases, from the general public to reduce on the cross-contamination, as well as training of staff and supervising them so that they know how to handle these Ebola suspects, and they know how to notify the general public should there be a need. That said, there's always a need to protect our healthcare workers. These are healthcare workers remain a very high-risk group, and without healthcare workers, we shall have lost the battle, because these are the people that are supposed to be there and help us in the fight. So if they get disease, if they get Ebola and they get diseased, we shall be at very huge risk. So there's an urgent need to protect our healthcare workers and ensure that they're protected at any time too. And facilities must always prioritize staff training, that is teaching their staff right from the askalis, the nurses, the doctors, the midwives, on how to suspect an Ebola case. Okay, then there has to be enough supply of PPE, the personal protective equipment, so that should there be a suspected case, people have the appropriate equipment to use, the appropriate materials to use in the fight and preventing themselves against contacting Ebola. There has to be safe specimen handling. Okay, if this patient is, for instance, bleeding, or you've gotten some blood samples from them, we have to handle this with utmost care. Less of that, there can always be contamination that can worsen this Ebola and Ebola spread. Okay, that said, we also have to ensure that we have exposure reporting mechanisms. If somebody has been exposed, there should be a way for them to know that actually we have been exposed, and that way they can be given the necessary care. We've heard of instances where a certain healthcare worker can be working in one facility, maybe a public facility, but then they're the same health workers who are working in other private health facilities. They could get exposure from a private facility, and then they carry the virus from a public facility. They could get exposed from a public facility, but then they carry the virus to a private facility. So there can always be cross contamination, and because of this, we always need to have clear exposure reporting mechanisms. If your facility, for instance, gets an Ebola case and it gets to be noted in the whole public, definitely be sure of possible negative publicity that could come along with this. And for that reason, we strongly encourage, or you've been encouraged, to ensure that you recognize the serious consequences of laxity. We have to keep all our guards at alert so that we don't have any lapses that result into spread of these diseases. So private practitioners have been encouraged to recognize these symptoms, do the needful in terms of isolation, notification, so that cases are detected early and we don't have spread of disease. Failure to identify, isolate or notify the cases could lead into spread of this Ebola virus. There can be spread of this Bundibujo virus, which can actually be very, very detrimental. This can result into loss of public trust, serious reputational damage, as well as regulatory consequences. One missed case in a private facility could actually become a major public emergency that could result into very, very many cases. Now, there's a need to learn from COVID cases that were there before, so that we avoid some of these mistakes. Uganda's COVID experience demonstrated the dangers of weak IPC adherence. In other words, if you don't adhere to IPC, there can definitely be disastrous consequences. Also, this experience that we had demonstrated to us the dangers of inconsistent screening, PPE misuse, as well as delayed reporting. We must hence avoid repeating situations where healthcare workers can contribute to the transmission of the disease. Ebola requires response. Ebola response requires discipline, vigilance, as well as system readiness from day zero. Less of that, we are at danger of having this disease spread far and wide. Talking a little bit about treatment and the treatment principles, isolation and treatment principles. So it's quite important for us to understand that cases, the moment they're suspected, it's important to have them isolated to reduce on the cross-contamination. And then where they're isolated, to rapidly coordinate with the responsible agencies, this time around including the Ministry of Health, so that they can come in and they do the needful. Definitive management should follow the Ministry of Health protocols and designated treatment pathways. For now, it has been made clear that it's only the Ministry of Health that has, well as communities. Now, continued provision of essential health care has to continue. This has been emphasized by Dr. Maureen in her early presentation, that facilities must always continue to deliver essential health care. Let there be no cessation of vaccination, family planning, usual clinical visits. Some of our patients have chronic diseases like hypertension, diabetes, thyroid diseases, renal diseases. Let care for these patients not stop. Let's continue to give care wherever possible, but we must remain vigilant and take all the appropriate care so that we don't have damage or severe damage arising as a result of this Ebola outbreak that has happened. Outbreak response should not completely disrupt the routine care in our facilities, okay? And there has to be a deliberate effort to ensure continuity of some of the services I've just talked about, and some other services including the maternal services, okay, the chronic care, the emergency care. People are going to continue getting road traffic accidents. People are going to continue getting trauma from all sources. Emergency care must always continue. Immunization and all that. So the goal is actually dual protection. Okay, controlling Ebola while sustaining health care is a goal. So we have this final call to action that every private facility must remember to identify early, isolate, okay, immediately, notify Ministry of Health, so that the health teams can act promptly, and invest heavily in infection prevention and control, protect staff and patients, as well as ensuring that we keep the essential services running and safely. That said, I'm about to conclude, but let me conclude with these key final remarks that I really think we need to be very, very familiar with. It's very important to strengthen community sensitization through partnerships. Okay? Community sensitization has to be strengthened. And if you're going to control the outbreak, we really need to not let the Ministry of Health do it alone. Each one of us has something that they can do in the control of this burden, the control of this disease. Even people in the communities out there, you have a duty to identify these cases and help with the notification. Inform your village healthcare team. Call the numbers that have been given to you so that the responsible teams can come, provide the support and help in the management of these cases. When we are having on this chart, there's one question that came through, and it was about how the Ministry of Health can partner with other collaborators. How can Ministry of Health collaborate with other partners to help in the management of this condition? And, well, the answer came out very clearly that there's a need to leverage the existing structures and networks. You all understand that already. There are quite a number of structures that are in place, and we definitely don't have to come up with totally parallel structures. However, we just have to come up with mechanisms that can leverage the already existing systems to fight this cause. So there are quite a number of partners that are already in place, including a Kampala City Authority, the Uganda Health Federation, who have greatly supported, even in this webinar that we just had. They're already collaborating with the Ministry of Health. There are professional associations, Uganda Medical Association, on which I'm the chairperson, CPD, and in my role, I'm in charge of ensuring that doctors have all the skills and knowledge that they need to help in the fight against Ebola. So, not just about Ebola, but all the conditions. Okay, my docket is responsible. I'm making sure that doctors have all the skills that they need, and their skills are up to date. So, some of these professional associations would actually be very, very helpful when it comes to managing Ebola. NGOs, the non-government organizations, there's so much that you have to do. I'm very much aware that there are so many NGOs that are helping with the provision of health care in Uganda. Please, NGOs, this is your time to shine. Come and give as much support as you can in the fight against Ebola. Local leaders, LOC1 up to LOC5, okay? Faith leaders, our beloved sheikhs for the Muslim religion, our beloved bishops for the Catholics and the Christians and the Protestants, and all faith leaders. It's something that you can do. You have your voices that are loud and they can be taken up by people. Please talk and encourage your people to take all the preventive measures so that we prevent and control this Ebola, as well as the community health workers, okay, the VHTs, the district health officers, and all officers in your respective capacities. There's something that you can always do to help in the fight against Ebola. So, some of these partners are already in place and they're supporting immensely. They are giving support and they need to continue with this support wherever they can. We need to deliver a unified risk communication. There's definitely a need to ensure that we communicate the same voice. All partners should communicate clearly, consistently, and based on evidence. I'm very much aware that there are so many rumors out there. Recently, out of a case where people in the Democratic Republic of Congo went and burnt down the hospital that was taking care of Ebola patients. Why did they burn it down? Simply because they felt that, this hospital is maybe there's some information they are concealing. Ebola is even non-existent, plus so many myth beliefs that are out there in the public. So there's definitely a need to ensure that we clear on all the myths out there and any misconceptions that are out there, so that we control this Ebola disease. That said, we definitely have to avoid providing conflicting information that fuels stigma. Okay, there's so much information out there that could actually fuel stigma, and also this information has to be counteracted. And we need to use multiple media channels. Right now we are using UMA TV. By the way, if you have not subscribed to UMA TV, there's no better time than now to subscribe, because we are bringing you all the information about Ebola. We first gave you the first keynote after there was a confirmed case, and we appreciate your viewership. So I've seen that the video has been viewed by 3.1k views. I mean, let's continue to push. And if you're watching this video, there's nothing that stops you from copying that link and sharing it with a colleague, sharing it in your WhatsApp group, sharing it in your family WhatsApp group, so that other people can get to know about Ebola and we all fight. So there's definitely a need to fight and fight and fight. Let's use all platforms possible. Social media is here to help us in the fight. Okay, radios are there, WhatsApp is there, TikTok is there. Make a TikTok video. If you get some information that can be helpful in the fight against Ebola, share it with somebody. Okay, so let us use all the possible avenues to fight against Ebola. Community radio stations. Okay, you can tag CBS, you can tag Simba, tag Capital FM, tag KFM, any radio that you are aware of. Then our WhatsApp groups, I've already mentioned about them. Health talks. Let's have doctors come and talk to us about this. Like right now I'm a doctor, and by the way, those of you who don't know me, my name is Dr. Sechanzi, and I'm here to talk to you about Ebola. So I'm sure so many other doctors out there are also giving talks. Listen to them. They are there on radio shows, they are there on TV shows. Listen to them. But apart from those health talks, there are community dialogues that are possible. The challenge with these community dialogues is the fact that we don't want many people to be gathered in one place at the same time, because this can further increase the risk. However, it would be good maybe if people can do some virtual sessions, talk virtually, have a WhatsApp chat to talk about Ebola, have an X space to talk about Ebola. And if we all do this together, we can definitely contain this Ebola virus. That said, I also need to highlight the fact that printed material, okay, flyers, posters, having information about how best Ebola can be contained could all be very beneficial in this whole process. So wherever possible, if you can share a flyer, these days even social media flyers are there, soft copies. If you can get one and you share it, why not? Let's continue to do this so that we continue to contain Ebola. I'll go ahead and tell you about some of the target high-risk groups and settings. Healthcare workers, we are at a very huge risk. Why? Because patients are going to come to us thinking they have malaria, thinking they're having maybe UTI, thinking they're having ulcer, yet actually they're having Ebola. So we are going to be in direct touch with them, and we can, contain the disease from them. So health workers, we are greatly at risk. That's why from today's webinar, it has been made very clear that health workers should always be provided with the adequate personal protective equipment to help them in the prevention against Ebola. But apart from the health workers, private clinics and pharmacies, these patients are going to come to you asking for medicine for flu, Panadol, contraceptives, yet actually they're having Ebola. They're going to make transactions with you using money. By the money carries some bags, okay? Money can carry some bags. And the patient is going to come to you not knowing that actually they could be having Ebola. In actual sense, they're having Ebola, so they can easily spread it to you. But health workers and pharmacists and these private facilities aside, there are many other groups which are at risk, including which ones? The market vendors, okay? The schools, teachers, people who are working in transport, the taxi drivers, conductors, religious gatherings, and densely urban communities. All these places, be sure a patient could come to you and they're having Ebola and you have no clue. They're making exchanges with you, they are giving you money, you're exchanging them with them, whatever commodities they are, and they're having Ebola and you don't know. So we need to be on the lookout because these groups are greatly on a high risk. That aside, there's a need to promote early care seeking and reporting. If you're a patient out there and you start to get some symptoms, it's very important that you get to seek care quite early, because when you seek care quite early before the disease has progressed very much, you can be helped. You can be given a supportive care against this Ebola, and with that, your chances of survival could really be improved. So we really need to ensure that the communities should know these symptoms, so that should they get these symptoms, they can respond. They can detect them early, report to the people concerned, and then they can be given the necessary help. We also need to know where to seek care early and safely, and also it's very important for us to report any suspected cases early. That said, we need to discourage self-medication, my people, especially in Uganda. I've seen many times you're going to be there and you get these symptoms, and the first thing you think about is to get some Panadol, go check for malaria. And we need to stop this self-medication. And where possible, we need to seek care from professionals who are going to detect our symptoms, and they decide that, hey, probably here we could be having Ebola, and maybe they offer the necessary help. Okay, so we need to stop the self-medication. Self-medication aside, we also need to stop considering illnesses. The many situations where we've had that someone could have a suspected case, and instead of reporting them, they choose to conceal the case because they think when they report the case, people are going to know and the whole family is going to be in danger, they're going to be isolated. Much as there could be some element of truth to the fact that, yes, if you're having a contact with a patient, probably we should not let you just go in the communities out there to spread the virus. However, this approach is much more safer than simply letting you be there with this patient who is going to continue spreading that illness to many other people. So it's quite important that should you suspect, don't conceal, talk to the responsible people so that you can be given the best help possible. We're continuing with this conversation. Again, I want to remind you that you're talking about Ebola, and today's webinar focused mostly on private healthcare providers who sometimes are not usually very much considered, and we are trying to look for the best ways most of you can be safely cared for and to contain this condition. And we've gone through quite a number of issues, and we are about to conclude this conversation. But as we conclude, we need to also combat misinformation and stigma. There's a lot of misinformation out there, too much stigma out there about Ebola, about the treatment and all that. Most of these myths have to be counteracted because most of the times, whenever these outbreaks happen, they generate a lot of fear and myths and stigma. And with social media, some of these myths could spread very fast, and there can be a lot of disaster. So let's continue wherever possible to counter these myths wherever they come. So Ministry of Health and partners should rapidly address misinformation using trusted voices like this one and factual information. There's a need to engage private sector fully, okay? Since many patients first seek care from private facilities, and private practitioners must fully be integrated into information sharing, surveillance updates, training, as well as risk communication efforts. The moment this is done, be sure disease is going to be controlled. There are a number of ongoing collaborations between the Ministry of Health, KCCA, and the Uganda Health Federation, which is excellent. We hope many more collaborations are going to be possible. We hope Ministry of Health can as well work with the Uganda Medical Association, an association where I'm the CPD chairperson, so that together we can control the virus. As I conclude, we need to reinforce the 5 moments of hand hygiene. So health workers must intentionally adopt and practice the WHO 5 moments of hand hygiene. And this hand hygiene remains one of the most effective and affordable and life-saving IPC interventions. So, what are these moments of hand hygiene? I understand many of you out there may not even know what these moments of hand hygiene are. But today, you're going to be able to see them. Which ones are those? Before touching a patient, okay? Because it's possible that you're the doctor, you could actually have carried this virus and you're going to pass it on onto the patient. So before you touch a patient, make sure that you wash your hands. By the way, by hand washing, we don't mean that you should only use water and soap. That's the most preferred. You can as well use an alcohol-based sanitizer, because these days they are everywhere and they are very, very flexible, affordable. So if you cannot afford soap and water, at least use an alcohol-based hand sanitizer. That's said, the other moment of doing hand hygiene is before a clean or aseptic procedure. Before you're going to conduct a procedure on a patient, before you're going to do a venipuncture, inserting a catheter, a cannula, before you do lumbar puncture, before you do specimen collection, before you do any procedure, please wash your hands. Third moment of hand hygiene, after body fluid exposure. After you've been exposed to patient's blood, to their cerebrospinal fluid, after you've been exposed to a patient's saliva or anything, please wash your hands. That's the third moment of hand hygiene. There's a fourth moment, that's after touching the patient. Remember, our first moment was before touching a patient. And also now, we've seen before touching a patient, before a procedure, before a clean or aseptic procedure, and then we've also said that after touching a patient. That's our fourth moment for hand hygiene. Lastly, after touching a patient's surrounding, wash your hands. Okay? You've been on a ward round, you've examined the patient, you've maybe touched their bed sheets, you've touched their cannula. Please wash your hands so that you avoid cross-contamination. So it's very important to always remember that gloves do not replace hand hygiene. Hand hygiene is key and paramount for any patient that you're going to meet. Perform hand hygiene before putting on gloves and after removing them, and facilities must ensure a reliable water supply. Sometimes you can have water shortages in our country, but with this Ebola, if you're going to contain this disease, we always need to ensure that we have reliable water supply, and we must always use alcohol-based sanitizers wherever possible, and hand hygiene stations at the screening places, at the triage, as well as the treatment areas. Now, this conversation has really been a very, very lengthy conversation, because as of now, we've been on for the last about 1.5 hours, and we are going to conclude in the next 5 minutes. We continue to appreciate you for being part of VMA TV. Like I always tell you, VMA TV is here to serve you better. If you've attended this webinar from the start, I believe there's something you've learned. There's something new that you've understood, at least about the current outbreak of Ebola. If you think that this video could benefit somebody else, please copy this link, share it on your status, share it in your family WhatsApp group, share it in your school WhatsApp group, or any WhatsApp groups that you belong to, so that some other person who has not seen this information can also learn something. If you have any feedback to give us, please come into the comment section down here. Write in your comment which other video would you want us to bring for you next time, so that you bring that same video and you watch it. If you have never subscribed to this channel, this lovely channel that is rapidly growing, what are you waiting for? Okay, go now and subscribe. Hit that notification button. When you hit that notification button, each time we post a video, you're going to receive a notification so that you follow. You don't miss out on any new updates about health. Like the video. Now, as I summarize in the next 3 minutes, I also want to take this opportunity to appreciate our audience. We have to appreciate you for being part of us. Without you, we are nothing. You are the reason why we continue to exist. So, continue supporting this channel. Let us grow together. I can't go minus mentioning the team that I work with, Giribo Highlights. Giribo Highlights, that is our person behind the camera. Giribo Highlights is bringing you this image. I'm sure you're seeing this image very clear. Okay, the image is clear, the lighting is good, the sound is good. The man behind all this is called Mr. Giribo Highlights. Real name Regaba Giribat. The man is very good at camera, and the man works for a very big company called DocPix. I'm sure I've been seeing adverts there running DocPix. DocPix have the best cameras in town. They take videos, they live stream. They are the ones who are bringing you this event live. So, should you have an event, a birthday, wedding, ceremony, I don't know if it does burials. I'm yet to confirm if it does burials, but DocPix, Giribo Highlights, they do all events. So, contact them, and they have always shared their numbers. Even on the screen right now, the numbers are there. So, get in touch with them so that you give them business. They will be able to support your event, and they'll bring your event live. Lastly, I want to thank Mr. Naiko Todan. He also works with UMA TV. He's a very, very big man for the brand. Let me just end with the key highlights from this webinar. This webinar started a long time ago. We're just ending it now. We've seen Ebola virus. By now, you know that Ebola virus is a viral hemorrhagic fever. By viral hemorrhagic fever, we are meaning it is spread by viruses. It causes bleeding. The word hemorrhage actually means bleeding. So Ebola actually causes bleeding. Okay, and patients will present with the fever. So we're having an outbreak, and from the last update that you've just had, Uganda now has about 9 cases, and we've already registered a mortality for a Congolese patient who was the index case. Some of the health workers that managed this case were isolated, and most of them have been monitored, and luckily they are showing progress, and actually some of them have been discharged. So we're having an outbreak that we must all work together. Don't leave this for only health workers. We must all come in and support and contain this virus, because if we don't work together, this virus could spread and spread. It could cause so many mortalities. We could end up dying. About the spread of this virus, basically it moves from one person to another through contact. So if I have it, I can spread it to another person. Okay, so it spreads through contact, especially contact that involves most of these body fluids. Okay, and this virus is going to gain entry into your body through the mucous membranes, your eyes, your nose, your mouth, your ears, and sexually. You can actually get it from your partner. Okay, the moment Ebola enters your body, it's going to take some time. By the way, it takes a bit of time to incubate. It's called an incubation period. During this period, the virus is going to multiply, and there'll be very many viruses in the body. They're going to affect many organs. They're going to use up some of the coagulation factors and platelets in the body, and consequently, there's going to be bleeding, simply because most of the platelets and coagulation factors have been used up. All these are going to result into a state where a patient is going to bleed. The moment you bleed, you're going to lose blood. Your blood pressures could drop, you could become anemic, you can get shock. Okay, hypovolemic shock, and this could actually result into death. Sometimes patients could even get what we call DIC, that's a disseminated intravascular coagulation. Ebola is not a new disease. Ebola has been around for quite a lot of time. I think I might check my history very well, but it's argued that these viral hemorrhagic fevers were first discovered back in the days around 1950s, or maybe even much earlier. And in its mechanism, it's argued that the bats, the bats in Uganda. Sorry, my friends who don't know Uganda, but bats. So basically, there's some the vector for this Ebola virus are the bats, and most of the people that have been shown to have had this disease in the beginning were people who were doing mining,
Why mining? Because as they were doing the mining, they were getting in contact with the excreta from these bats. The uric acid is excreted by the bats, and it's argued that that's where these viruses began from. Ebola is not the only viral hemorrhagic fever. No, there are quite a number of others, including Marburg virus, okay, and many other viral hemorrhagic fevers. So they could cause early mortality. Those of you, anyway, these days there has been a lot of advancement in technology that actually the mortality rates have reduced. Otherwise, back in the days, if somebody had Ebola, mortality rate was almost close to 100%. But now with technology, with advancements in healthcare, the mortality rates have greatly dropped. When someone, so what are the signs and symptoms of Ebola? So a patient with Ebola is going to come in with fever, weakness, nausea, vomiting. They could come in with bleeding, though not all the time. So that all the time they will come in with bleeding. So sometimes bleeding is actually a manifestation. So sometimes patients are going to come in when they're not having the bleeding. Okay. So if you suspect a patient to be having Ebola, if you're a doctor, or even if you're in a community there and you're suspecting somebody to be having Ebola, the thing we've been advised to do is this patient should be isolated in a safe place. If it's a health facility, you've been advised to at least have some basic temporary isolation facilities. At the moment you isolate, notify the responsible people. For now, the responsible people are the Ministry of Health, who have all the skills to manage these cases. After you've notified, these will come and they take care of this patient. So basically in the health facilities where they are taken, these patients are going to be supported. They'll have their symptoms managed. Basically they'll have supportive care. They'll be hydrated with fluids. They will get blood. They will be fed well. They will be given antipyretics, and with this, they can actually, with the support, the body can actually be supported and the disease controlled. That said, in the community level, there's so much that we need to do. So we have to be very vigilant. We have to try and protect ourselves. We must avoid mass gatherings. In the health facilities, there should be screening points at the end of the entry points, so that if anybody walks in, their temperature should be taken, and should it be found high, appropriate interventions must be well taken. I want to end here with this chat. I just want to thank you very much for being a great audience, and should you have any questions, please feel free to reach out to us. Thank you very much, and have a great time. I'll be looking forward to your questions in the comment section. I remain Dr. Sechanzi Henry. Bye.